Aesthetically speaking, dental implants are a great tooth replacement in the front of the mouth. We prefer not to try and cut other teeth down, and a dental implant allows us the ability to not cut teeth on either side down. It adds back to the foundational support as opposed to taking away support, which other teeth do. In the anterior area, which is the aesthetic zone of the mouth, it's very important that you have an experienced surgeon do your implant in that area. Unfortunately, just being off on the position of the implant by just a few degrees can really affect the cosmetic result, giving an implant that either the tooth looks too short or even worse in a high smile line patient, way too tall, being very unpleasant in terms of the appearance of it. So we take pride in our anterior implants, making sure that we've positioned them in the right position in a person with a normal bony profile. We get real concerned in the person who doesn't have a normal bony profile though, because oftentimes it takes extra surgical procedures to try and have a truly cosmetic result in those cases. And if you think you can just put an implant in that kind of case and you're going to be done and have a beautiful smile, that's not always the case. And it's one of the advantages of having someone like a periodontist do your implant in the aesthetic area, is that they're going to look at other things that they're going to give the patient the best results in that. So one of the things that we've been doing probably over 10 years at this point in time, and probably have over 1,000 cases of it that we've done, is what we call an immediate extraction, immediate implant, and immediate provisionalization. And what that means is that a front tooth gets taken out, we put an implant in that position, and we put a temporary restoration on at that time. In those cases, we run at well over a 99% success rate. And for me, what's the most critical aspect of those cases, remember, this is in the front of a patient's mouth. You can imagine the fear of a patient who comes in and they've broken their front tooth off, and someone's telling them that you've got to have this tooth taken out, and to be able to take that tooth out, put an implant in, and give them a temporary so that they walk in with a tooth and walk out with a tooth, to us is probably one of the most gratifying things that we do in this office.